Pro Medicine.
Hello guys, today we will talk about cardiac tamponade, and it's very interesting and so important topic, so I can't stop talking and need start talking about this topic. Okay, what is cardiac tamponade? It is accumulation of fluid or blood in the pericardial sac. That builds up pressure in the pericardium and resists the heart for ventricular filling, thus leading to insufficient blood supply to organs and may result in shock or even death. It is considered as a medical emergency. There you see a picture where we see a patient with cardiac tamponade, and you see that patient often will be in a condition like shock or like extremist condition. We will see his neck veins because they will dilate and they will distend. We will hearing heart sounds distant, and often patient will have venous pressure elevated. What is pathognomonic for this situation? Sometimes decreased arterial and pulse pressure often exists but not pathognomonic. And sometimes we will hear pericardial tap at Larei's point. It's like diagnostic and decompressive method. There we see that cardiac tamponade venous pressure rises progressive and linearly. And arterial pressure, you see that it is non-progressive, yes, it will decrease, yes, but with small elevated and not linearly, yes, unreliable. Okay, this picture I take from Nether Atlas, where he tell and explain this topic. Okay, there you can see reasons of cardiac tamponade. It can be malignancy, HIV infection, infection with viral, bacterial, fungal, drugs of course, gidrolizine, percalminate, isoniazid, minoxidil, post-coronary intervention, trauma, iatrogenic, for example, sternal biopsy, transvenous pacemaker lead implantation, pericardiocentesis or central line insertion, uremia, idiopathic pericarditis, complication of surgery at the esophageal-gastric junction such as anti-reflux surgery, pneumopericardium, radiation therapy, connective tissue disease, post-myocardial infarction, and cardiovascular surgery. 3 possible pericardiac compression syndromes. First is accumulation of pericardial fluid under pressure and may be acute or subacute. The second is constrictive pericarditis, scarring and consequent loss of elasticity of the pericardial sac. And the last one is effusive constrictive pericarditis, constrictive physiology with a coexisting pericardial effusion. Now let's talk about pericardial effusion. It typically has 20 or 50 milliliters of fluid. Acuity of fluid accumulation plays large role in pericardial compliance. Rapid accumulation, for example trauma, gives pericardium no time to adjust, therefore a small amount of fluid can cause tamponade. Slow accumulation allows pericardial compliance to increase, allowing a large volume of fluid in the sac. However, when pericardial pressures more than right ventricular pressure, tamponade physiology can occur. Compression of all cardiac chambers due to increased pericardial pressure. Pericardium has some compliance with increased pressure, but once that is exceeded, it begins to impair diastolic compliance, reducing cardiac filling. Much of the pressure is transmitted to the right ventriculum or right atrium, lower pressure system, which causes bulging of interventricular septum and decreased left ventricular compliance and filling. In cardiac tamponade, extra volume pushes the interventricular septum to left. Less ventricular diastolic volume, lower stroke volume, lower systolic blood pressure during inspiration, and that decrease in systolic blood pressure of more than 10 millimeters Hg is called pulsus paradoxus. There you see a picture, funny picture, yeah, and there all what you need to know about this topic. Always we talking there that heart feeling some pressure, yes, we see that neck veins will distend, yes, we see that aorta haven't got many blood, yes, because we less cardiac systolic volume, yes, and it lead to hypotension. And look, aorta says that he think that we mean backstride. What is backstride? We will talking after. And accumulation of fluid, muffled heart sounds, all are there. All what you need about this topic is in this picture. And now let's talk about backstride and all symptoms. Backstride is distended of vehicular veins, hypotensions, and distant heart sounds. If you hearing distant heart sounds, it's a problem. What more? Tachycardia and coughing, tachypnoea called clammy extremities, malignancy, weight loss, fatigue, anorexia, chest pain, pericarditis, joint pain, connective tissue, renal failure, uremia, medications, drug-related lupus, recent procedure, pacemaker, central line, TB, night sweat, fever, radiation, cancer, history. Physical examination. First of all, you need to find a backstride. The next one, hepatomegaly, evidence of chest wall trauma, pulsus paradoxus, more than 10 mm Hg, Kussmaul sign, paradoxical increase in venous distension and pressure during inspiration. Abolished descent. Diagnosis. ECG, low voltage, sinus tachycardia, PR depression, electrical alternance. CXR, enlarged cardiac silhouette, water bottle shaped heart. Echocardiogram, tamponade is clinical diagnosis. Pericardial effusion, early diastolic collapse of the right ventricular free wall, late diastolic compression, collapse of the right atrium, swinging of the heart in its sac, left ventricular pseudo hypertrophy. There you see X-ray in the right, of course, picture. Yes, there we see a big heart. And in this picture you see better the pericardial fluid. Yes, all this one is pericardial fluid, but in X-ray you will see this picture and try don't Try, don't think that it is hydropleuritis, hydrothorax. Okay, ultrasound. Of course, we need to say that if we see backstride, yes, and if it don't mix up with tension pneumothorax, hypertension, jugular venous distension, absent read sounds, if we see in ECG electrical alternance, we need to do ultrasound for patient, and we can find a pericardial effusion, yes, there, and heart. Okay, diagnosis. Right heart catheterization in if patient is stable and diagnosis is in doubt, can perform a right heart catheterization to measure right-sided pressures. In tamponade, near equalization within 5 mm Hg of the right atrial, right ventricular diastolic, pulmonary arterial diastolic, and pulmonary capillary wedge pressure. Right atrial pressure tracing show abolished systolic and descent. Treatment. What to do while you're waiting on CT surgery? Answer is easy, it is oxygen. Volume expansion with blood plasma or saline to maintain adequate intravascular volume. Bed rest with leg elevation. These may help increase venous return, and else you need using inotropic drugs, for example dobutamine. Choose inotropes that do not increase systemic vascular resistance while increasing cardiac output. Once CT surgery or cardiology arrives, recurrent effusion. Pericardiocentesis can be fluoroscopically or TTE guided. Pericardial window involves the surgical opening of a communication between the pericardial space and the intrapleural space. Recurrent effusion, pericardectomy, pericardial peritoneal shunt, pericardiodiasis. That means that we using corticosteroids, tetracycline, or anti-neoplastic drugs that can be instilled into the pericardial space, sclerosing the pericardium. If we talk about pericardial tamponade, you need remembering hydrothorax, and the treatment is the same. Treatment. When no one shows up and cardiac arrest is called, emergency. You need to do emergency subxiphoid percutaneous drainage. A 60 or 18 the gauge needle is inserted at an angle of 45 angle degree to the skin near the xiphocoastal angle, aiming towards the left shoulder. Yes, you see that it's lying to left shoulder. When performed emergently, this procedure is associated with a reported mortality rate of approximately 4% and a complication rate of 17%. Yes, and there you see that we using two pericardial needle. Yes, where the after we stand a catheter, yeah, and it will be there to decrease the pressure. That's all. Thank you very much for your attention. Where I want you be more clever with my video or no. but I wanted. Okay, thank you very much. Have a nice day. Ciao.